Hello friends, let's see the anatomy of the urinary bladder. This urinary bladder is a hollow viscous or organ which acts as the reservoir of the urine. When we see the position of the urinary bladder, it is depending upon the uh, age of the individual and the amount of the urine present within the bladder. In case of the adults, the empty bladder, it is purely pelvic in nature, so it is situated within the pelvic cavity. So here in this figure, we can appreciate the adult urinary bladder, and here this one is the pubic symphysis. So in case of the adult, the neck of the bladder lies at the approximate level of the lower border of the pubic symphysis. So this one is the sagittal section of the male pelvis, and this one is the sagittal section of the female pelvis. Here also we can appreciate that the neck of the urinary bladder, it is at the lower border of this pubic symphysis. So in case of the adult person, this urinary bladder is pelvic in nature, where the neck of the urinary bladder, it corresponds to the lower border of the pubic symphysis approximately. While when we see the young child, in case of the young child, when we try to draw the bladder, and for that, when we draw the sagittal section, so this one is the pubic symphysis, and here this is the bladder. So in case of the children, the neck of the bladder, it corresponds approximately to the upper border of the pubic symphysis. So when the bladder is empty, in case of the children, the neck of the bladder, it corresponds approximately to the upper border of the pubic symphysis. So in case of the children, it is abdominopelvic in nature, as the children having pelvic cavity which is very small, and that is the reason why the bladder is abdominopelvic in nature. In case of the adult, when the bladder gets distant, it may becomes ovoid and it may reach up to the abdominal cavity. So at the time of the distension of the bladder, it is abdominal pelvic in case of the adult. So here we have drawn this pubic symphysis and this anterior abdominal wall, and the bladder, when it is distended, it becomes ovoid in shape. So in case of the adult, when the distension of the bladder occur, it becomes ovoid in shape and it becomes abdominopelvic in position. So here we have seen the position of the bladder in case of the adult as well as in case of the children, and along with that we have also considered the amount of the urine if it is present, or if the bladder is distended, it becomes ovoid and becomes abdominopelvic in position, while if the bladder is empty, it remains pelvic in position in case of the adult, and it remains abdominopelvic in position in case of the children. Now when we see the shape of the bladder, when it is empty, it is tetrahedral in shape, and when it is distended, it becomes ovoid. Now let's see the capacity of the urinary bladder. The mean capacity of the urinary bladder, it is around 220 ml. The sense of the filling occur when the bladder is full with the urine up to 100 to 150 ml. The first desire for micturition occur at around 150 to 250 ml. The physiological capacity of the urinary bladder is the filling of the bladder until the undue discomfort to the individual, and that is around 250 to 400 ml. And the anatomical capacity of the urinary bladder is the capacity of the urinary bladder until it get brushed, and it is around 1 liter to 1.2 liters. So all these are the capacity of the urinary bladder. Now let's move on to the presenting parts of the urinary bladder. So when we draw the adult urinary bladder, it looks like tetrahedral in shape. So it has one apex which is situated anteriorly, And this apex, it is connected with the remnant of the urachus and it remains as the median umbilical ligament. It has one posterior surface or the base. It has one superior surface. It has two inferolateral surfaces. Out of the two, we can able to see only one inferolateral surface. And when we talk about the borders of this urinary bladder, it has one posterior border which is responsible for separating the superior surface from the base. On the both the ends of the posterior border, we have the attachment of the ureters. This urinary bladder having two lateral borders which are responsible for separating the superior surface from the inferolateral surface. This bladder having one anterior border and this anterior border is responsible for separating the two inferolateral surfaces. And along with all these external features, it has one neck, and that neck, it is the lowest part of the urinary bladder from where the ureter arises. So this one is the neck of the urinary bladder. Now let's move on to the relations of the urinary bladder. Now when we see the relations of the urinary bladder, the apex of the urinary bladder having attachment of one ligament, and that ligament, it is the median umbilical ligament, which represents the remnant of the urachus and reach up to the umbilicus. In case of the male, the superior surface, it is related with the coils of the intestine. So coils of the small intestine which are present on the superior surface of the male urinary bladder. And the superior surface, it is separated from the coils of the small intestine by the peritoneal fold. So this one is the peritoneal fold which is going to cover the superior surface of the urinary bladder, and it reaches up to the upper part of the posterior surface of the urinary bladder, and then it reflects onto the rectum. In case of the female, this one is the median umbilical ligament which reaches up to the umbilicus, and it is a remnant of the urachus, and the peritoneal fold, it is going to cover the superior surface of the urinary bladder, and it reflects onto the anterior surface of the uterus to form the vesico-uterine pouch, and then it reaches up to the posterior surface of the uterus. So the superior surface of the urinary bladder in case of the female, it is related to the anterior surface of this uterus, which is separated from the superior surface by the peritoneal fold, and that fold, it is called as a utrovesical pouch. When we see the relations of the base of the urinary bladder, in case of the male, it is related with this vas deferens and the seminal vesicles, and it is also concerned with this rectum. So this ampulla of the rectum, it is also in the posterior relation to the base of the urinary bladder. This ampulla of the rectum and the seminal vesicles and vas deferens both are separated by one thin fascia of the peritoneum, which extends from the perineal body up to the rectovesical pouch, which is a pouch formed by the peritoneal fold. And that fascia, it is called as the rectovesical fascia. This rectovesical fascia, it is also called as Dinenvelius fascia. Here we can see the posterior surface of the urinary bladder in case of the male, it is covered by the peritoneal fold in the upper part only, and just below it, it is non-peritoneal in nature, and that non-peritoneal portion which is somewhere present here, this is called as the external trigone of the urinary bladder. In case of the female, the posterior surface, it is completely non-peritoneal in nature, and it is related with this cervix and the upper part of the vagina. So these are the relations of the posterior surface of the urinary bladder. When we see the neck of the urinary bladder, this neck of the urinary bladder, in case of the male, it is concerned with this prostate gland. And just below the prostate, we find the one partition, and that is called as the urogenital diaphragm. In case of the female, the detrusal muscle of the urinary bladder, it extends till up to the urethra, whole urethra. And that is the reason why the whole urethra is the part of the urinary bladder. We can consider the whole urethra as a part of the urinary bladder, and that's why it is included within the neck of the urinary bladder. Now let's move on to the inferolateral relations of the urinary bladder. When we see the inferolateral surfaces of the urinary bladder, the space between the pubic symphysis and the inferolateral surface, it is called as the space of the Reggius. So now let's see the space of the Reggius, the brief introduction to the space of the Reggius. When we see the space of the Reggius, it is the empty space which is situated on the inferolateral aspect of the pelvic wall and the inferolateral surface of the urinary bladder. So that space of the Reggius it mainly contains the retropubic fat as well as the vesical veins, the plexus of the vesical veins. And this space is responsible for the operative procedures of the urinary bladder. So here in the female, this is the space what we are talking about, and this one is the space of the Reggius. So all these are the important relations of the urinary bladder.